Dear student, today we shall discuss lung tumor. So we are now in the last segment of respiratory disorders, that is lung tumor. So let us try to classify lung tumor. So WHO has given the classification of lung tumor in this way. Usually, the lung tumor is broadly classified into two types. One is primary lung tumor and another is secondary lung tumor. So, it has been seen that the secondary lung tumor is slightly more common than primary lung tumor. Usually, secondary lung tumor arises from the distant site due to the metastasis of tumor from different route, either by the direct route or by the hematogenous route or by the lymphatic route. The lung can be a site of metastasis from the tumor arise from GIT or breast, thyroid, kidney, pancreas, even from lung, and sometimes from the other side like in the bone, especially osteosarcoma, neuroblastoma, and one tumor of kidney that is known as Wilms tumor. They can secondarily involve the lung and causes secondary lung tumor. So lung can be a very important site, very common site for the metastasis of different type of tumor from the brain, from the thyroid, from the kidney, from the liver. It can the tumor can spread through the different channel, either from the lymphatic channel or by the blood hematogenous route. The lung can be involved and lead to the development of secondary lung tumor. Secondary lung tumor generally seen in the peripheral part of the lung, and it appears as a single or multiple in nodular form. And if you go for the X-ray examination, you will find that there is a characteristic appearance that is known as cannonball appearance. So secondary involvement of the lung by the tumor appears in radiologically as a cannonball appearance. So this is something about the secondary lung tumor, but we are mainly concerned with the primary lung tumor. Primary lung tumor arise from the different parenchymal component of lung. Like if it is arise from the epithelial component, it can be either benign tumor or it may be either malignant tumor. So benign epithelial lung tumor that is like adenoma, like papilloma. So this is the benign epithelial lung tumor, and it is malignant form is in the form of squamous cell carcinoma. That is the most common histological type of bronchogenic carcinoma, that is squamous cell carcinoma. Besides this, other type of carcinoma included in the epithelial component of lung tumor, like a small cell carcinoma, large cell carcinoma, adenocarcinoma, squamoadenocarcinoma. Sometimes it may be undifferentiated form. So these are the some tumor that arise from the epithelial component of lung parenchyma. This is the primary tumor. Sometimes in rare cases, the tumor can be arise from the mesenchymal component of lung parenchyma, and the mesenchymal tumor like pulmonary hematoma, chondroma, perivascular epithelial cell tumor, or maltoma, that is a lymphohistiocytic tumor. So another tumor that included in the primary lung tumor that arise from the lymphoid component, like lymphohistiocytic tumor जिसको हम लोग बोलते हैं, इसमें माल्टोमा हो सकता है, या डिफ्यूज लार्ज सेल लिम्फोमा हो सकता है, या पल्मोनरी लैंगहेंस सेल हिस्टियोसाइटोमा हो सकता है. सो दीज आर द ट्यूमर दैट अराइज फ्रॉम द लिम्फोइड कंपोनेंट ऑफ lung parenchyma. So and last the primary tumor can arise from the germ cell, ectopic in origin. So tumor lung can be involved by the ectopic erosion like from the germ cell in the form of seminoma or teratoma. So these are the some primary lung tumor that arise from the different histological component of lung, from the epithelial component, from the mesenchymal component, from the lymphoid histiocytic component, from the ectopic component. सो डिफरेंट साइट से डिफरेंट तरह का ट्यूमर निकल सकता है. बट वन थिंग इज क्लियर दैट इपिथेलियल ट्यूमर इज स्लाइटली मोस्ट कॉमन प्राइमरी लंग ट्यूमर. उसमें भी द स्क्वामस सेल कार्सिनोमा इज द मोस्ट कॉमन ट्यूमर दैट कैन बी सीन in day-to-day practice, or incidence rate is more high. So this is the usual classification of lung tumor. Now come to the most important lung tumor that is known as lung cancer also, and that is known as, in the other word, it is known as bronchogenic carcinoma. So we shall try to study bronchogenic carcinoma. And the bronchogenic carcinoma, as you know this fact, that it is the most common tumor in the male. In the male, it is nowadays, till a day, you can say that it is the most common tumor. So if you see the incidence rate of tumor in the male side, the lung tumor is most common. So male are more commonly affected than female. The usual age is about 55 to 65 year of the age is vulnerable. ऐसे तो मेल is more commonly affected, but one type of tumor that is known as adenocarcinoma, they are usually more common in female than male. So ऐसे तो मेल में ज़्यादा होता है, लेकिन एक ट्यूमर that is known as adenocarcinoma is slightly more common in the female. So this is the some important fact about the bronchogenic carcinoma. Now let us see what are the etiological factor of bronchogenic carcinoma. So what are the causes? So causes of bronchogenic carcinoma is multifactorial. There are many factors. Predisposing factor, etiological factor are associated for the development of bronchogenic carcinoma. They play role, some of them play directly or indirectly, or by the activation of oncogene that are leading to cause development of lung tumor in the form of bronchogenic carcinoma. Among the etiological agent, the most common agent is smoking. So smoking is the most common cause of lung tumor as a whole, but bronchogenic carcinoma is mostly associated with the exposure or of smoke. Smokers are very commonly affected. So a smoker that may lead to the bronchogenic carcinoma, and this occurrence or development of bronchogenic carcinoma due to the smoke, that depends upon many factors. That what is the amount of taking the cigarette smoking or any exposure of smoke, amount कितना है, कितना दिन से, duration is very important. What is the dose of smoke, what is the immunological status, whether there is a coexistence of any other respiratory disease to the patient. So that are the many factors that play a role directly or indirectly along with the smoking in the occurrence of tumor. But one thing is clear, that it is a insidious process. It is take a long duration for the development of fully bronchogenic carcinoma in a smoker. First of all, it causes a chronic irritation that may lead to the metaplastic changes in the form of squamous metaplasia. These metaplastic changes undergo dysplastic changes, and if the smoking is continue, and if other factors are added, that may lead to the dysplastic changes may be converted into the neoplastic changes, and that may initiate the bronchogenic carcinoma. And it has been seen that histologically squamous cell carcinoma and small cell carcinoma are most commonly associated with smoker. दो तरह का जो ट्यूमर है, squamous cell carcinoma and small cell carcinoma is very commonly associated with the lung tumor. But one question is certainly arise in our mind, that how this smoking causes lung tumor or bronchogenic carcinoma. So this is a very stepwise process. It requires many a long duration for the fully development of malignant changes in the epithelial component of lung, and that lead to the bronchogenic carcinoma. As you know this fact that smoke has got many chemical carcinogen, and most commonly the indirect acting carcinogen like polycyclic aromatic hydrocarbon is present, and this carcinogen is playing a role in the development of chemical carcinogenesis. So when for the long duration exposure of smoke, this indirect acting chemical carcinogen undergo metabolic activation, and this metabolic activation occurs mainly in the liver, especially in the cytochrome P45 system that is present in the endoplasmic reticulum, and due to the activation of this chemical carcinogen, they produces electrophiles, reactive electrophiles, and these reactive electrophiles target the DNA, and DNA is going to damage. DNA undergoes some genetic mutation changes, and that changes initiate the chemical carcinogenesis, that in the sense that when the DNA is damage is not repaired, that causes proliferation of the cells in uncoordinated and in not in appropriate way. The cell proliferate or proliferation occurs in the very uncoordinated way, and that initiate some of the hyperplastic, dysplastic, metaplastic changes, and it is followed by the malignant changes in the form of bronchogenic carcinoma. This smoke does not only cause this is the main mechanism in the form of chemical carcinogenesis, but on the other hand, this smoke has got some of the active metabolite in the form of nicotine acetylcholine, and that nicotine acetylcholine has got different role to initiate the cancer. So smoking has got both type of action in oncogenesis. It acts as a initiator. Some of the metabolite ingredient in the smoke causes initiator of carcinogenesis, and some of them are promoter also. So initiator, the nicotine acetylcholine initiate the chemical carcinogenesis in the form of it inhibit the apoptotic mechanism. In the other, it also causes a secretion of the hormones that lead to, especially hormones that lead to the acts as a tumor promoter. So the ingredient of the or metabolic active substance in the smoke has got both action, initiator of carcinogenesis as well as promoter of carcinogenesis because of release of certain hormones from the tumor cell in the form of paraneoplastic syndrome that is associated with the small cell carcinoma. So different kind of hormones are released, and they act as a they causes a different type of clinical manifestation, but also it acts as a promoter of chemical carcinogenesis in case of development of bronchogenic carcinoma. So इनिशिएटर का भी रोल अदा किया, प्रोमोटर का भी रोल. फिनॉल, दैट इज ए वेरी इंपॉर्टेंट मेटाबॉलिक सब्सटेंस दैट इज प्रेजेंट इन द स्मोक एंड दैट आल्सो एक्ट्स एज ए ट्यूमर promoter. Not only in this way, it also overactivate the oncogene, mutation in the certain oncogenes, and that lead to initiate oncogenesis. It also suppresses, inhibit the tumor suppressor gene like p53 and RB gene. So in this way, there is a broad spectrum action is mediated by the active substances or chemical carcinogen present in the smoke. So in this way, different action, different channel, different way, this smoke causes development of bronchogenic carcinoma, meaning by they act as initiator of carcinogenesis, they act as a promoter, they inhibit the apoptosis mechanism, they also causes direct action to the damage of DNA, they also activate or overexpress the oncogene, they also inhibit the tumor suppressor gene. So there are different mechanism, different action is going to done by the active substance or chemical carcinogen present in the smoke in the form of polycyclic hydrocarbon, aromatic hydrocarbon, nitrosamine, phenol. So these are the substances that play a role in the development of bronchogenic carcinoma. So this is the very important fact you must know, that the basic mechanism behind the development of bronchogenic carcinoma due to the long exposure of smoke or smoking. Besides smoking, the another less important causes like exposure of radiation in the form of physical agent or long exposure of atmospheric pollution. So those people who are living in the heavy polluted area, they very much exposed to the different kind of carcinogen or smoke, and that may initiate or may act additive action in the development of carcinogen, in the development of bronchogenic carcinoma. Occupational hazard, you know this fact that some of the occupational disease that may be associated with the lung carcinoma, bronchogenic carcinoma, especially asbestosis, exposure of nickel, beryllium, asbestos, metal, iron, and iron oxide also. So these are the some occupational hazard, occupational component that long exposure may lead to the development of bronchogenic carcinoma either directly or along with the smoke. Some of the dietary factor also playing the role, that the lack of vitamin A or C are also associated with the development of bronchogenic carcinoma, that it is essential for the epithelialization of the lining epithelium of the bronchial epithelium. So vitamin A is very necessary. So lack of vitamin A may play indirect role in the development of carcinoma. And certain chronic scar, if it is present in the lung parenchyma for long duration, made by the different disease like chronic pneumonia, tuberculous pneumonia, because in both conditions after healing there may be chance of formation of a scar in the lung parenchyma, and if this scar is also associated with the development of bronchogenic carcinoma or lung cancer in the form of adenocarcinoma, in the form of which type of tumor, that is adenocarcinoma. So scarring due to tuberculosis or due to pneumonia or due to the asbestosis or due to the chronic interstitial disease or due to the scleroderma. So these are the some conditions that are associated with the formation of a scar in the lung parenchyma, and that may lead to the development of adenocarcinoma in future. So this question is very much asked, that a scar is associated with which type of cancer, lung bronchogenic cancer, the bronchogenic lung tumor, that is adenocarcinoma. So these are the some important etiological agent. Again, I told you that one factor is not responsible. Many factors are playing the role in different way, different mechanism, and as a result, the lining epithelium first of all undergo metaplastic changes in the form of squamous metaplasia, and this squamous metaplasia undergo in the form of dysplastic changes, and when this is continue for long duration, there may be development of new plastic changes in the form of bronchogenic carcinoma. So these are the some etiological factor and the basic mechanism behind the development of lung tumor. यहाँ पर थोड़ा सा मोलिकुलर बेसिस भी जान लेना चाहिए कि which oncogen or tumor suppressor gene are associated with the occurrence of a lung tumor. So the most important the molecular basis for the development of bronchogenic carcinoma is that the first basic defect, the genetic defect or molecular defect is in the way that there is overactivation of growth promoting oncogene, overactivation. So all these etiological factor may are directly or indirectly associated with the molecular changes, molecular genetic changes or mutational changes that may initiate or that may provoke the development of bronchogenic carcinoma. So one of them is due to overactivation or overexpression of growth promoting oncogene, like especially KRAS gene is very important here. This is the oncogene that their overexpression may lead to the occurrence of mutation in this gene. Oncogene may lead to the development of carcinoma, bronchogenic carcinoma. And less important oncogene, their overexpression may cause bronchogenic carcinoma, that is known as BRAF gene, PIK3CA gene, MYC family gene, and BCL2 gene that are associated with the anti-apoptotic function. BCL2 genes is associated with the anti-apoptotic function. So these are the some oncogene. Their mutation or overexpression may lead to the development of bronchogenic carcinoma. In the other way also, there is if there is a inactivation of tumor suppressor gene, जो ट्यूमर को सप्रेस करता है, उसको प्रोलिफरेशन को रोकता है, एंजियोजेनेसिस को रोकता है और न्यूप्लास्टिक चेंजेस को रोकता है, वो जीन दैट इज नोन एज ट्यूमर सप्रेसर जीन, उसका अगर इनहिबिशन हो जाए, वो इनएक्टिवेट हो जाए, तो दैट मे ऑल्सो लीड टू द डेवलपमेंट ऑफ bronchogenic carcinoma. And two tumor suppressor gene are very important here. One is known as P53 gene and another is known as RB gene. So these two genes are very important. They are tumor suppressor gene, and if it is going to inactivate by any region, that may be associated with the development of bronchogenic carcinoma. And another important relation here, that RB genes, that is that they are changes, they are associated with the development of retinoblastoma, that is the tumor of eye, retina, and it has been seen because of this common oncogene common tumor suppressor gene, RB gene, it lead to the development of both tumor in a individual retinoblastoma as well as bronchogenic carcinoma, because of the common association of tumor suppressor gene like RB gene. And this also give some important fact that somewhat the lung tumor may be genetic or it may be familial tendency if it is associated with retinoblastoma because of presence of कॉमन ट्यूमर सप्रेसर जीन लाइक आरबी जीन. तो अगर आरबी जीन की मौजूदगी में और उसमें अगर ये होता है तो कभी कभी हम लोग मान के चलते हैं कि कहीं ना कहीं लंग ट्यूमर जो है दे आर genetically predisposed or it may run in the family, it has got, but it is not a usual phenomena, it is very rare. So these are the some important fact. यहाँ पर एक जीन जो है जो ज़्यादा इम्पोर्टेंट है, एंड दे आर वेरी कॉमनली एसोसिएटेड विद द mutation in this gene, oncogene known as EGFR gene. EGFR gene. So EGFR gene, their mutation or their overexpression is associated with the development of adenocarcinoma. So this gene is play the role in their mutation, play a role in the mutational changes in the tyrosine kinase family and domain, and that may initiate the anti-apoptotic phenomena. They also causes metastasis of the tumor. They also causes extra or intracellular neoplastic changes, neoplastic changes or metastasis, or sometimes they may causes angiogenesis. So these are this gene is very important regarding in respect of adenocarcinoma. That gene is known as EGFR. So their mutational changes, especially along with the tyrosine kinase domain mutation, they are associated with the development of adenocarcinoma in the 70% of the cases. And this fact give a very important significance in that way that their inhibitor are used in the treatment of adenocarcinoma, that is peripheral lung tumor. They are treated by the drugs which inhibit the mutational changes in this gene. कौन सा जीन? That is EGFR टायरोसिन काइनेज फैमिली म्यूटेशन. इसको इनहिबिट करने वाला जो दवा होगा, दे आर क्वाइट इफेक्टिव इन द ट्रीटमेंट ऑफ एडिनोकार्सिनोमा. एक और जीन होता है दैट इज नोन एज एनाप्लास्टिक लिम्फोमा काइनेज. एनाप्लास्टिक लिम्फोमा काइनेज, इन द शॉर्ट टर्म इट इज नोन एज ALK. Their rearrangement are also associated with the development of adenocarcinoma. So certainly the inhibitor of this gene mutation or rearrangement may play a role in the treatment of lung tumor, especially adenocarcinoma. So these are the some oncogene that are associated with the development of tumor, and they are has got a very important significance that their overexpression or mutation, if inhibited, the drug which inhibit their mutational or overexpressive changes, certainly they play a role in the treatment along with the other chemotherapy. They may give a quite effective treatment in the bronchogenic carcinoma. इसके इनहिबिटर के साथ साथ कीमोथेरापी, सर्जिकल ट्रीटमेंट, रेडियोथेरापी, ये सब कंबाइंडली अगर हम लोग दें तो दैट मे बी क्वाइट इफेक्टिव इन द ट्रीटमेंट, और इट हेल्प इन द enhancing the survival rate, expectancy of life. It may be enhanced by giving the drug that which inhibit the mutational changes in these two type of gene known as EGFR and ALK gene that they are associated with which type of tumor, that is adenocarcinoma. So these are the some molecular figure, molecular basis of development of lung tumor, especially bronchogenic carcinoma. So bronchogenic carcinoma, the etiopathogenesis is explained. I think the etiological factor, how they smoking is the main factor, how they play the role in the development of cancer, it is already explained. So if the tumor is going to produce, that can be manifest in the form of different type of clinical presentation. So clinically the tumor can causes a variety of manifestation, local manifestation as well as systemic manifestation. So locally, because of the obstruction made by the tumor, the new growth in the lumen of the bronchi that causes obstruction, and this obstruction may lead to the development of bronchopneumonia, lung abscess, bronchoectasis, lung sometimes it may be associated with the other changes like in the form of amyloidosis. So this type of local changes can be seen, or cavity formation in the lung parenchyma, obstructive lesion in the lung parenchyma, bronchi, and that create a lot of different type of manifestation. So this is the feature that is initiated by the local compressive effect or obstructive effect by the lung tumor. Sometimes this may be associated with the metastasis. So metastasis or the local compression effect like in the superficial venal cavern syndrome, painful bony lesion, paralysis of nerve, neurological manifestation. So it is due to the metastasis. And sometimes it may be associated with the paraneoplastic syndrome, and this is a very important site for asking the many question in MCQ based examination, that the lung tumor, especially in case of a small cell carcinoma, the tumor cell produces ectopic hormone, and their over secretion of this hormone may play a role in the different way according to their nature and their function. Suppose if the ACTH hormone is produced by the tumor cell in large amount, it causes feature of Cushing syndrome. If ADHR produces in large amount, it causes hyponatremia. The tumor cell may produces parathyroid hormone, so that may lead to the hypercalcemia. There may be chance of overproduction of calcitonin, so that may lead to the hypocalcemia. Gonadotrophin can be released by this tumor cell, lead to the gynecomastia. Serotonin can be released by this cell, like lead to the carcinoid tumor. So various type of manifestation are developed because of the release of the various kind of over secretion of various kind of hormone, and that manifest in the form of a variety of symptom, and whole symptom is known as paraneoplastic syndrome. So you must know the paraneoplastic syndrome of lung tumor, because this question is very much asked. Sometimes this tumor can causes clubbing, neuromuscular defect like in the polymyositis, myopathy, or peripheral neuropathy, or in subacute cerebellar degeneration, skeletal defect like hypertrophic osteoarthropathy, clubbing, cutaneous symptom like acanthosis nigricans, cardiovascular symptom like in the form of thrombophlebitis, that is known as Trogia syndrome, hematological manifestation in the form of coagulation defect like in the form of DIC and leukemoid reaction. So you know this fact that various kind of manifestation are developed due to the lung tumor, either by the local, some of the effect are due to the local obstruction, local complication, and some of the effect are due to the